Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I will be talking about a common condition called vertigo. So let's get started and find out more about this condition. In this video, I will be focusing on what's benign positional vertigo, what is the cause, what are the symptoms, who gets it, how long do they last, its treatment, and at the end of the video, I will give you a list of foods to avoid if you have vertigo. So stay till the end. What's vertigo? Now, it's a spinning sensation of the head that's brought on by a certain position of the head, usually sudden changes of position. Or in other words, it's dizziness that is brought on by changing the position of your head. So if you've been experiencing something like this, and this has happened out of the blue, it's time to see your doctor and get yourself checked, because there are around 40 underlying causes of vertigo. Now, today we will be focusing on benign positional vertigo, and the word benign means that it's not a serious condition and is likely to eventually get better. Now, what's the cause? In most people, the cause is unknown, but it can follow accidents causing neck or head injuries in some people. There are two theories to explain benign positional vertigo. The first one says there's a problem that exists in the neck, usually a kink in some of the swivel joints of the neck. The neck is connected to the balance center by special nervous pathways. And the second theory talks about some tiny pieces of floating debris in the balance center of the inner ear. These little bits of sediment somehow upset the balance center when disturbed. Now, what are the symptoms? A brief attack of severe dizziness, usually for about 10 to 30 seconds, that comes on a few seconds after a certain head movement, and it quickly subsides. These attacks are provoked by change in position of the head, such as tilting the head backwards, changing from lying to sitting position, lying on one ear or the other, and turning the head to the side with neck injury. Now, who gets it? Although it can occur at all ages, the elderly are affected most. It's commonest cause of vertigo in the elderly. Women are twice as likely as men to get it. Benign positional vertigo is a surprisingly common problem. How long do they last? Each attack usually lasts less than 30 seconds but can last 60 seconds or so. The attacks tend to come in bursts but usually settle within a few weeks, and most people are able to return to work within a week. The bouts tend to come back after months or years, but some people only ever have one attack. What are the effects of benign positional vertigo? There are usually no ill effects in the long run. Unlike some other causes of severe dizziness, there's usually no vomiting, tinnitus, or deafness, and the affected person has to be careful with driving. Now, what's the treatment? No special treatment is required, only self-help is usually recommended. Drugs are not effective at preventing the attacks. It's basically a matter of allowing the bouts to run their course, but there are some things that may help, such as avoid head positions that provoke the attack, do special neck exercises, and obtain mobilization treatment to the neck by a qualified therapist. Now remember, there are some red flags. That means you need to see a doctor immediately if you develop a fever, if you have vision problems, hearing loss or difficulty speaking, if you feel weak, numb in your arm or leg, if there is a fall or difficulty walking, or you develop a new headache. Now here's a list of foods too that helps to control vertigo, and these are the foods to avoid. Avoid consuming fluids that have high sugar or salt content in it, such as concentrated drinks and soda. They trigger vertigo. Now, caffeine intake should be avoided because it may increase the ringing sensation in the ear of the person with vertigo issues. Caffeine is present in tea, coffee, chocolate, energy drinks, and colas. Avoid excess salt intake. It causes fluid retention in the body, affecting the fluid balance and pressure. High salt in diet may trigger vertigo. A food rich in sodium, like soy, chips, popcorn, cheese, pickles, papadums, and canned foods, are to be avoided. Replace regular salt with low sodium salt. Nicotine intake or smoking to be avoided because it narrows the blood vessels and reduces the blood flow to the brain and hampers in recovery. Now, alcohol intake has to be reduced. It adversely affects metabolism, dehydrates the body, and its metabolites are harmful to the inner ear and brain. It may trigger vertigo, migraine, and nausea vomiting in vertigo-prone individuals. Processed food and meat are some of the foods to avoid with vertigo. Bread and pastries can even trigger vertigo. Fried foods should be completely avoided when you go on a vertigo diet. Pickled and fermented foods may aggravate symptoms of vertigo. Now, these are the foods that you need to include that will help to control vertigo. Now, incorporate these foods that are anti-inflammatory and detoxifying. They reduce swelling of the tissues in the inner ear, repair the cells, and ensure healthy cell regeneration. The first thing is to stay hydrated. Drink plenty of water and stay hydrated as much as possible. Include tomatoes in your diet. They are rich in potassium and they help flush out excess fluid from the body. Tomatoes are counted as the best vertigo or dizziness treatment food. Nuts are rich in antioxidants. Nuts are counted as one of the best foods for vertigo as they are rich in vitamins. Nuts improve blood circulation in the body and inner ear. Ginger. Ginger may cause vertigo-associated symptoms like nausea, may ease vertigo-associated symptoms like nausea, lightheadedness, and vomiting. Ginger roots are regarded as the best foods for vertigo. Drinking ginger tea daily is quite effective in treating vertigo. However, ginger is not advisable for patients with diabetes and on blood-thinning drugs. Foods rich in vitamin B and C, zinc and magnesium to be included because they help restore nerve damage and improve blood circulation. Now, the foods listed may provide relief to some people. Everybody reacts differently to different foods. It may help to maintain a diary of food lists that trigger your vertigo. Slowly, you can have a personalized list of foods to counter dizziness. So start making a list of foods that can actually aggravate your vertigo. That's all for today. I hope this information regarding vertigo was helpful. Thank you for listening. If you wish to hear more of such kind of health videos, support my channel by liking, sharing, and subscribing it. Bye for now.